Hello, it's Dr. Sam Goldhaber, president of NATF and cardiologist at Brigham and Women's Hospital in Boston. And I'd like to talk to you today about how COVID-19 has really changed the environment we work in and what it feels like to be in the hospital, and also to talk about some of the silver lining of COVID-19, particularly the markedly increased use of telemedicine. Well, if you were to go around the cardiology offices today, instead of having perhaps 60 people working here, including staff and cardiologists, there are probably more like 6 or 8. The place is pretty deserted. Most people are working at home. Those who are doing an in-hospital service are here, of course, to talk to and examine the patients. Those who are doing outpatient clinics, though, have mostly switched over to telemedicine. The hope is that we, the healthcare providers, can stay pretty healthy, but we're not counting on it. In fact, we have backups for just about every medical job here. We actually send a lot of fellows home, and we send some doctors home to really be on the bench, as we call it, to be here to fill in when someone really goes down and can't work because of COVID. And unfortunately, we've had to start using our bench people, but yet there's a special cooperation and collaboration and can-do attitude that is very inspiring. Everyone is working together. It's the same mission. We want to flatten the curve of the number of patients so that we can accommodate them in the hospital. We've just increased our capacity to have 75 intensive care unit beds specifically for patients stricken with COVID-19. And of course, we'll have step-down units for those patients after they are transferred out of the intensive care unit. Special teams are being put together of nurses, physician's assistants, doctors from intern to resident to fellow to junior staff to senior staff to cope with the problem. It's really an all hands on the ground effort, and the enthusiasm and determination really shine through. We're doing virtually all our calls and discussions about patients over software such as Microsoft Teams or Zoom. And we're learning, even if we're not naturals at it, we're all learning how to use this very well. In the outpatient clinic, about 10% of our patients come in for in-person visits, and the rest are receiving virtual visits, either video conference visits or more frequently telephone virtual visits. The virtual visits have really gained a lot of patient satisfaction and a lot of satisfaction by the healthcare providers. So telemedicine is really going to advance a lot during the COVID-19 crisis. And even our rounds are done mostly with telemedicine. We can sit in separate rooms as a team and get everybody on the same screen and share a screen and go through all the data patient by patient by patient. And then probably just one of us would examine the COVID patient in order to minimize exposure. So that is what things are like now. I think the big question for us is, when will life get back to normal? We are going by the motto of hope for the best, but plan for the worst.